MRI and PET scans are two commonly used diagnostic imaging tools that play a crucial role in the diagnosis and monitoring of various medical conditions, including cancer. Both MRI and PET scans produce images of the inside of the body, which can provide valuable information about the structure and function of internal organs, tissues, and bones. However, while both tests can be useful, they have some significant differences that patients should understand when considering which test is best for their imaging needs. One of the main differences between MRI and PET scans is the imaging technique used to produce the images. Magnetic resonance imaging uses a strong magnetic field and radio frequency waves to produce detailed images of internal structures, while positron emission tomography uses a small amount of radioactive material and a special camera to detect changes in metabolism and blood flow. MRI scans work by aligning hydrogen atoms in the body with the magnetic field and then using radio waves to disrupt this alignment. As the hydrogen atoms return to their normal alignment, they emit signals that are picked up by the MRI machine and used to create detailed images of the body. PET scans, on the other hand, work by introducing a small amount of radioactive material into the body. This material is typically injected into the patient's bloodstream and travels to the target area where it emits positrons. When positrons collide with an electron, they produce gamma rays that can be detected by the PET camera. This scan data is used to create images that reveal metabolic activity and help identify areas where cells are using more energy. Another significant difference between MRI and PET scans is the length of the scan. MRI scans typically take longer than PET scans, often 30 to 60 minutes for an MRI compared to 15 to 30 minutes for a PET scan. This can be a factor for patients who have limited time or who may experience anxiety or claustrophobia during scans. A key difference between MRI and PET scans is the amount of radiation exposure involved. PET scans use a small amount of radioactive material, which can expose patients to low levels of radiation. This can be a concern for some patients, especially those who need repeated scans. On the other hand, MRI does not use ionizing radiation, making it a safer imaging option for patients who need repeated scans or who are concerned about exposure to radiation. Both MRI and PET scans can provide valuable information about the inside of the body, but they provide different types of information. MRI provides detailed images of anatomy and tissue structure, which can help diagnose and monitor conditions such as tumors, inflammation, injury, or degenerative conditions. PET, on the other hand, provides functional images that reveal metabolic activity and help identify areas of the body where cells are using more energy. This can be useful in the diagnosis and monitoring of conditions such as cancer. In the case of cancer, MRI can provide high-contrast images of tissues and affected areas, which can help doctors determine the size, location, and extent of the tumor. MRI can also help distinguish between benign and malignant tumors based on the characteristics of the tissue. PET scans, on the other hand, provide functional images by administering a glucose-based PET contrast agent that travels through the bloodstream to reveal areas of increased metabolic activity and blood flow. This imaging technique takes advantage of cancerous cells' reliance on glucose in the bloodstream for energy. PET scans can help healthcare providers determine the stage of the cancer, identify areas of the body that may be affected by metastasis, and monitor the effectiveness of treatments. Thank you for watching. Please consider subscribing to the channel for more helpful radiology content. Click the video on the left to learn all about PET scans, or click the video on the right to learn all about MRI. Thanks again. We'll see you next time.